Okay, I see that we have our participants joining and we are going to get started because it is 10 a.m. Hello, everyone. Thank you for joining us this morning, afternoon, or evening, depending on where you are. I'm thrilled to be co-hosting this webinar by the Global Strategy Lab, the International Network for Women Against Tobacco, and the Center of Excellence for Women's Health. Today's session, Women, Gender, and the Future of Tobacco Control, Global Perspectives and Policy Action, will focus on why gender-responsive approaches are essential to strengthening tobacco control research, policy, and practice. Tobacco use remains one of the leading causes of preventable death globally, and while tobacco control efforts have driven important progress, gender-responsive approaches are still not fully integrated into research policy and practice. In this webinar, we will hear from each of our panelists about their perspectives and experiences, and then move into a guided conversation. Before we begin, I want to warmly welcome all attendees and thank you for being here. My name is Latika Laguwaran, and I am the Director of Operations at the Global Strategy Lab, a research and policy organization at York University in Toronto, Canada. Our work in tobacco has focused on understanding how gender is integrated in tobacco research and on applying rigorous quantitative methods to examine gender differences in smoking patterns globally. More recently, our team has developed a gender disaggregated international cigarette consumption data set that will be widely available upon publication of the data set. I would also like to introduce our co-host, the International Network for Women Against Tobacco, or INWAT. INWAT is a global network founded in 1990 by women tobacco control leaders to address tobacco use among women and girls. INWAT holds observer status with the World Health Organization, and many of our panelists today are members of this network, and we're very pleased to have them with us. We encourage everyone interested in this network to learn more about INWAT and consider joining. We do have a link in the chat that will be available to you if you are interested. A few housekeeping notes before we get started. We will be using the Zoom Q&A box for questions, so please submit your questions there as the discussion unfolds. This session is being recorded, and the recording will be shared afterward. Please also take a moment to introduce yourself in the chat by sharing your name and country. We would love to see who's joining us today. Now, I'm pleased to introduce our distinguished panelists. First, we have Yvette Emembwe. She is a spokesperson at Global Youth Voices, convened by the Global Center for Good Governance and Tobacco Control, where she works to amplify youth voices in support of strong, ethical, and accountable tobacco control policies that protect public health and future generations. Next, we have Dr. Larissa Alwar. She is a public health advocate and founding member of Tobacco Free Jordan with over 14 years of experience in tobacco control policy, research, and youth focus advocacy. Her work spans national, regional, and international levels, including co-authoring Jordan's Tobacco Industry Interference Index and leading research on tobacco marketing near schools. Then we have Blanca Llorente. She is the research director at Fundación ANASH, a think tank in Colombia. She has over a decade of experience in tobacco control advocacy, particularly advancing tobacco taxation policies in Colombia and across Latin America. Her work focuses on promoting evidence-informed public health, environmental, and human rights policies. And finally, we have Kelsey Romeo Stuppy. She is the managing attorney at Action on Smoking and Health, where she leads global programs on tobacco industry liability and human rights advocacy. Since 2013, she has worked to advance accountability for tobacco-related harms through legal action, policy engagement, and advocacy within the United Nations system and the WHO Framework Convention on Tobacco Control. Thank you all for being here. We're now going to move into the presentations, and we'll begin with Yvette.
Thank you so much, Larika. And it's an honor to be part of this conversation alongside powerful women leaders. It's a very timely and much needed conversation. And as you have highlighted, we know that tobacco use remains one of the leading causes of preventable death. But what is becoming increasingly clear is that tobacco control efforts are not keeping up with the pace and how gender is shaping the risk, exposure, and vulnerability as well. And too often, gender is still treated as an add-on rather than something that should be fundamentally shaping how we design policy, research, as well as interventions. In my community and area of work, we are seeing clear shifts in how tobacco use is emerging, especially among young girls and young women. For example, e-cigarettes, mostly shisha use, has become increasingly normalized and is even glamorized in many social spaces, especially among women. But beyond that, we are also seeing something that is more hidden and harmful, where tobacco use is linked to misinformation, social pressure, and gender expectations around relationships and sexuality. Young girls and women are inserting raw tobacco for sexual pleasure, especially in rural areas, leading to increased number of cervical cancer cases in Zambia. Now, these are not just individual cases or choices. They are shaped by social norms, limited awareness, and the gaps that we have in interventions that are targeting young women. And yet, our responses are still gender neutral. And in practice, we are really gender blind. Policies, interventions, and research are not fully accounting for gender differences in the exposure, in access, or in the social realities that are shaping decision making. So we end up responding to a very specific and evolving problem with general solutions. So if there is a key takeaway that I would love to leave with the audience, it would be this. If we're really, really serious about the future of tobacco control, then gender cannot be an afterthought. It has to be the starting point. And this is something that we are seeing echoed across contexts, different contexts through the Global Youth Voices Network, where the youth are raising the same concerns globally.
Thank you, Yvette. That was a great talk. There's so much that you included in your presentation that I think is really important for us to speak more about. I think it's important that context is taken into place anytime that we develop any kind of program, intervention, policies, especially hearing from your own experience of what's happening in certain rural areas. I think a lot of that doesn't get quite captured into the policies and programs that we see globally. And I think you're right. General solutions are not enough. And we're seeing that they are impacting men and women quite differently and even other marginalized populations as well. So thank you for sharing that. Next, we will have Dr. Larissa Alwar speak.
Thank you so much, Latika. Thank you, everybody, for joining us to this really important topic. I think what I want to focus about is how the industry and how the norms change very slowly, sometimes so subtle that we don't even understand or see what is happening around us. And they can come in different forms. And I would really like to focus on my country, Jordan, because I witnessed the change from tobacco being a taboo. When I was at university, if a girl smoked, she would do it in the bathroom. It was not acceptable for anybody to smoke in public spaces, or if a female smoked in a public space, it would have been looked at negatively. Then in the mid-1990s, suddenly the male-dominated water pipe coffee houses became family-friendly cafes. And usually when they talk about family-friendly, it means it is a space where women are welcomed, because even in the regular way that people speak about their wives, it's she's my family more than she's my wife. That's a traditional way of referring to your wife. So very slowly, the scene changed. We had the water pipe cafes emerging, and also the product changed. So instead of having the harsh tobacco that men used to smoke, we had suddenly sweetened molasses with fruity flavors, with candy, with names where you couldn't even understand what they mean, like love, déjà vu, which were very talking to women. And this was making smoking, or is making smoking, more and more accepted in the community. And then now with the introduction of those emerging products, the heated tobacco products and e-cigarettes, the problem has definitely expanded, and these are not looked upon as a smoking. And whilst you would never see a woman smoke a cigarette on the street, you see them now walking on the street, in the car, holding a heated tobacco product or an e-cigarette, and this is totally acceptable. So we have now the normalization of smoking. And when we look at water pipe use, actually it's the only tobacco product where the percentage of women using it is higher than the percentage of men. And in Jordan, we really have a very high prevalence of smoking amongst men. It is now 72%. But if we look back at history, the change in male prevalence hasn't changed much in the past 20 years, only 1.4%. Whilst the use of tobacco products between 2004, where it was 7% in females, has become in 2024, 28.8%. It quadrupled. And this also has been reflected in the cancer rates. And this is a very important topic. Like my colleague just said, Yvette, before, cancer is on the rise among women. And between the years 2000 and 2014, the annual rise in cancer in women was only 0.2%. Now it's 6%. And the rate of tobacco-related cancer diagnosed in 2023, the number of cases was higher than that of breast cancer. So we are definitely seeing a new pattern emerging. But also what is something very worrying is how important it has become that there is smoking and water pipe in social functions, and that we have even doctors sometimes talk about this in a way that will make them acceptable. And a very, very specific incident last month that a very prominent neonatologist, a female doctor, she put a Facebook post out, and she said about commonly asked questions, and one was about smoking water pipe during breastfeeding. And she said, at this time, I will take the side of the mother. If smoking water pipe makes her relaxed and allows her to continue breastfeeding, so I will allow it to her, as long as she smokes 2 to 3 hours before breastfeeding. And I think once we become that acceptant of using a tobacco product, then we do have a real problem. Thank you.
Thank you, Dr. Larissa. That was a very powerful talk, and just to hear about what is happening in Jordan, I think is something that a lot of other countries can relate to, especially with the newer tobacco products that are being used. I know in South Asia, chewing tobacco is quite prevalent, and even in some countries, women are chewing more. And so to see sort of how these norms have been shifting and how it's becoming more acceptable, it is concerning and is definitely something that we need to take action on. So thank you for sharing that. Next, I will have Blanca speak. Thank you.
Thank you very much. I certainly share the concerns proposed by my previous colleagues about the consumption issues and the feminization of consumption in Colombia. The school population, we see a gap that is being reduced year after year between women and men in this population. Certainly, that's the result of intentional and very successful marketing tactics directed to girls and young women. But I want to share with you a different side of the problem with a very brief story. Let's take a real life situation. 2 young women, 25 years old, Patricia and Angela. They both work at the same place. But Patricia now has to quit her job. No one else can take care of her mother, who has become seriously ill because of a cancer related with tobacco consumption in her own family history. Patricia has now lost her job. Her family has lost their only source of income because she was the only one bringing money to the household. and their access to healthcare and social protection is very limited. Her mother now feels very sad because she made a big effort paying for Patricia's education in the hope that she had a better future than herself. On the other hand, Angela keeps working. She's now saving to pay for her studies and future professional plans. In the future years, Angela would continue her studies, has access to higher income opportunities, and even helps her parents, now that they are retired, to pay for household expenses. Now, even she has access to credit to buy her own place. Two different tracks, one reality: tobacco impacts in the lives of these women. One takeaway I would like to bring to the table during this hour of conversation that we are proposing today is that we need to gain a better understanding, avoid the traps of social norms that imply that women, it's our reality. We need to take care of these patients, and we have to take it as it is, and translate this into more effective communication of the differential impacts of tobacco in our society and the urgency to address them. Thank you.
Thank you, Blanca. I think you just showed us how important it is to share the stories of, these women that have these different circumstances, have, are either using tobacco or know someone in their family that's using tobacco. I think that often, even when we see policies and programs, again, they are created more generally. They're not taking into account these nuances, these very different experiences. There's so many factors at play. We hear about social determinants and different population factors, and often, people think about the individual and the individual behavior, but we need to avoid going down that route, and we have to think of these broader societal factors. Now I'd like to welcome Kelsey to speak on the topic as well.
Thanks so much for having me. I think I'm going to take this a little bit more of a global perspective. I see the audience in the room, and I'm sure many of you do not need these statistics, but I think it's always helpful to start. Approximately 200 million women smoke tobacco worldwide. That's a huge number, and it's growing. Smoking prevalence is lower among women than men, but women still make up about 20% of the world's smokers. As I said before, this is expected to grow with the potential to reach over 500 million if current trends continue. So this is a huge and growing problem. Tobacco is a women's rights issue, and it's also a human rights issue. And I don't think that enough of the tobacco control community or the human rights community is sort of reaching across the aisle and breaking down the silos to work on these problems together. ASH has been leading work over the past few years to try to help do that. We partner with organizations in countries who are due to report before human rights treaty bodies, namely, in this case, CEDAW, which is the Committee on the Elimination of Discrimination Against Women. Every country that's a party to that treaty, which is a huge number of countries around the world, almost all of them, has to report every 5 years, and the committee has a chance to speak to the government about what they're doing well or not well. And civil society has the opportunity to influence that by submitting a parallel report or by making oral interventions or even by influencing the government's report. So ASH works with partners in the countries that are reporting to highlight what's going well or not well with women's protection against smoking in those countries. We, a couple years ago now, submitted multiple reports for one session. We called it a CEDAW blast to try to get the committee's attention really focused on tobacco. So there's 6 or 7 countries per session, and we had 4 of them submit reports on tobacco. In addition, we were asked to give a presentation before the committee. This is a really big honor. It's not given very often, and it was just tobacco control and public health advocates speaking to the committee about why tobacco is an issue. We've seen some big results from this. In our more recent reportings, we've started getting responses from the committee to the government specifically referencing tobacco. For example, in a recent one we submitted with our partners in Luxembourg, they actually included tobacco in the concluding recommendations to the country of Luxembourg, which means that the next time in 5 years that Luxembourg comes up for review, this committee will ask the government, how have you fixed this problem? I also wanted to highlight something that Blanca just said because I think it's hugely important. The women's rights issues around tobacco are not just women who smoke. It's also exposure in the workplace, it's caregivers, there's environmental consequences. Women are more subject to environmental harms than men are. So this is hugely impactful in all areas of tobacco, and the UN human rights system helps provide one avenue for us to try to take tobacco control a step further.
Thank you so much, Kelsey. And thank you for sharing all the great work that ASH is doing in this area, especially sort of linking the challenge of tobacco with human rights, I think is so important, is also to get attention of governments and countries about this challenge and why it's important. Next, we want to move into our moderated discussion. I first want to thank all the panelists for the thoughtful opening reflections. And while we are having our moderated discussion, I do welcome all attendees to please include questions in the Q&A, and we will make sure to get to that. So to begin first, we've heard both about community level dynamics and industry strategies. So for Yvette and Larissa, from your perspectives, how do gender norms and industry tactics intersect in shaping tobacco use among women and girls? And I know you spoke a little bit about this, but if you want to expand a bit more on what you presented.
Thank you, Larissa. That's a very good question, actually. Building on what I had shared earlier about the shifting patterns, we see this clearly reflected in the data. So I'm just going to share some data from the Global Youth Tobacco Survey in Zambia. So it shows that electronic cigarette use among girls aged 13 to 15 was at 16.6% higher. And for the boys, it was at 15.4%. And this was in 2021. That was the latest data. Now, this is 5 years later. Imagine what the statistics would look now for a country that does not even have a tobacco control bill yet. So this marks a shift from the traditional cigarette use, where boys normally have a higher prevalence compared to girls because it's considered not a very girly thing to do. But with the upcoming of vapes and shisha and the glamour that influencers share on platforms like TikTok, many girls and young women have been lured into these products because when you look at a pink vape, a guy or a man would not use a pink vape. So this is strategically for the girls to initiate more girls. And so what this shows is that the industry is not just expanding, but it's expanding differently in its strategies to reach more girls and young women. And this is where the gender norms and the industry tactics now intersect. So in many contexts, very specifically in low and middle income countries, young women are normally navigating expectations around identity and what it means to be modern, independent, or socially accepted. We've heard of terms like being an alpha woman, trying to appear strong, and the tobacco industry has jumped on these narratives. They are doing it so effectively in positioning the products to respond to these narratives in the way that they bring out confidence, in the way that they bring out the autonomy and the belonging. And from a youth perspective, this is also amplified through the digital spaces where exposure is constant and often unregulated. In Zambia, we have so many vape pages that just showcase their vape products, and it's so glamorizing. And when a young girl sees that, a young woman sees that, they would want to fit in society and start vaping as well and start using shisha. And in some contexts, we have seen that this has extended to the rural areas where the social and sexual expectations placed on women further normalize the use of tobacco in ways that are often underlooked. And this is something that really has to be looked into policy-wise. So the girls and young women are being reached in ways that feel very relevant to their lived realities. This is their reality. And this means that our responses also need to operate at that same level of specificity and awareness, and not just generalize everything. Thank you.
Thank you, Yvette.
Yeah. So I just want to continue on what Yvette has been saying, and focus on the tobacco industry tactics. Definitely, they are feminizing tobacco use. It has become just part of our daily life. So as I said before, between the fruity molasses and the water pipes that are just talking to women looking like lipsticks, the industry has really expanded into knowing how to reach them. For example, you need a handbag that goes with your water pipes in order for you to put the water pipe in it, to take it with you from place to place. This is very thought about. There is the industry now that has special carpets or special tables for your water pipe so that it will not ruin your furniture. These are very well thought of strategies to address women and to encourage the use of these water pipes, for example, inside the house, which is something that we always talk about, that you shouldn't smoke inside your homes, but it has become such a norm, and they just provided everything that a woman might need in order to use it whenever. I mean, one of the things that I think, the innovation of the products, even of the traditional products. So if you see a water pipe that is becoming advertised on social media that looks like a coffee capsule machine, so in order for you to avoid all the mess that comes with using charcoal, this is a way that the industry is thinking how it can evolve its products so that they will talk to the modern woman, as opposed to the traditional way of water pipe use with heating the charcoal and preparing everything. So they market it as a clean way to use water pipe. Also, they reach women at their specific spaces. Like, for example, who would imagine that there would be a water pipe or water pipe sponsorships for events that are health-oriented? Like there was an event for breast cancer awareness where the ticket was, you come and you enjoy with the ticket a soft drink and a water pipe. So that was the event. So these things, they work in order for you to remove the harm of the product from what is actually happening to you. And I think this is a very subtle way and very smart way to normalize it and keep it there. If we look at the advertisement, and I think one of the very important outlets for the advertisement today is the social media. And the way that the industry relates itself to DJs, to social media content creators, to singers, and they hold these events that are very much targeted to youth and to women. We have now in March, there was the event that was sponsored by ICOS, which was the Women's Month. And they had lots of advertisements on social media asking the women to pass by the ICOS booth and get their special gift. And they were collaborating with a chocolate brand. So, and the packaging was amazing. So they are really feminizing the use of these products, because the market, when it comes to men, is actually already, there's a very high prevalence of smoking. So men are not as interesting to the industry at the moment as women are, especially in our areas, the lower middle income countries, where smoking was not as prevalent amongst women like men. But if we look globally, there's actually a new trend that we are observing. I don't know whether you have noticed this, but there's this smoking nostalgia that is going on social media. We are receiving nonstop these posts where, for example, we have a fashion magazine cover with a prominent person smoking cigarette on the cover, where we have dresses being shown with the cigarette in the model's hand. And there are posts that show women smoking with sentences like, "We need to start smoking again." I think society started to collapse when we stopped smoking, and they would go on and on. We might think of it as something that is innocent, or it just happened, we just happened to see it. But when we keep on seeing the same posts with different women, different settings, even different age groups, all talking about the nostalgia of smoking and the freedom that it gave, and the way that we used to sit outdoors with a cup of coffee or a glass of wine and a cigarette in the hand and talking about our problems, and everything was much better when we were allowed to smoke. I think this is a very interesting turn of events, that they are trying to reintroduce even cigarette smoking, which has somehow taken the backstage with the younger generation when it comes to smoking, where the younger generation still prefers e-cigarettes and heated tobacco products to start with, at least. And I think we need to be very aware about what is the industry doing, and sadly, we always follow them. They are the one who lead the happenings, and we, as the tobacco control community, we just follow. And I think we need to start thinking about what is there, anticipate the next steps in order to prevent us of going back to where we were a couple of decades ago. Thank you.
Thank you, Yvette and Larissa, for sharing your reflections on that question. I think, as you both mentioned, it's really surprising to see how many ways industry has sort of captured the attention of the women population, and really capitalizing on things such as flavors, but also words that, show that they're linked to empowerment and independence. And I think even just, what you just shared, Larissa, it's a problem that we don't really even take notice of. It's happening all around us. The marketing is there, and it's very subtle, but it does, sort of seep into the communities and the populations without us even recognizing that it's a problem. And your last point about tobacco control communities, we tend to be, far way back where industry has all the data, they have all the research, they know exactly how to get to the populations that they need to reach to, and we're still trying to catch up to that. And it's so very important that we, think about what data we have accessible, we notice that these patterns are happening, and that we try to take action as soon as we can. And I know even looking in our chat, we have lots of questions about that, and so we'll be able to speak more about that. I do want to now move to our next moderated question for Blanca and Kelsey. From a policy and accountability perspective, where are current approaches falling short in addressing gender in tobacco control? And Kelsey, if you want to go first, please go ahead.
Sorry, couldn't get the mute there. I think the first thing is that the Framework Convention on Tobacco Control is fantastic. It's the best practices for tobacco control, but it is lacking an enforcement mechanism. And human rights mechanisms can help provide that. So it's another tool that we should be using in our arsenal against the tobacco industry. In addition, reaching outside of tobacco control brings new people to the table. And I think most importantly for the tobacco control community right now, it might help bring new money to the table, which is something all of us need very much as well. I also just wanted to highlight that litigation is something that we should be discussing. It's certainly not new to the tobacco industry. The industry has been using it as a tool for decades, but our community needs to flip that. We should be using more proactive litigation against the against the tobacco industry. Human rights litigation is taking off around the world. All of you may have seen in the EU, the Grandmas for Climate Change movement, and their litigation has made it all the way up. And there's been a lot of successful litigation against corporate malfeasance in the past couple years, it's a great potential path to tobacco endgame, and our community should consider it more.
Thank you, Kelsey. Blanca.
Yes, well, there are many things, but I would like to focus my comments on the issue of measurements of the impacts. We don't have comprehensive measurements that are robust, updated, of differential impacts, which is, I think, an important issue to make the gender perspective of tobacco social costs visible in the policy discussions. In Colombia, even at the general level, beyond tobacco, we are in the early stages of making these differential impacts. And going back to my example of the caregivers and how women in the Latin American context bear the larger part of this burden is in their early stages of discussion. And we are starting to discuss the policy implications. But I have to say that even for us, women working in tobacco control, I see, and this is a reflection I have done about my own perception as a woman working in tobacco control for almost 2 decades. Sometimes I see as a normal issue that women take care of patients, that women dedicate so many hours to take care of patients, and that's just the way it is. That's the way of life. That's part of the social norm that we need to challenge and bring to the discussions, because we are not doing that. I think we are having more successful about the rights of children, somewhat to bring them to the discussion and to move the commitment of policymakers. We need to do more about this. One example, I was just looking for examples from Colombia of measurements. I found a very small study analyzing the case of 77 patients of non-communicable disease patients in Bucaramanga, as one of the medium-sized cities in Colombia. And the results didn't surprise me. 80% of the caregivers of these patients were women. The average age was 40%. The average time dedicated to care issues was 14 hours a day. And this is unpaid care. 60% of the patients were responsible before becoming ill of the family income, the sole responsibles. Half of the patients had to stop working because of the disease. And the rest reported a 33% cut in their income. That is the reality that we need to bring to the table with larger numbers and convincing numbers and reliable numbers. The cost to the families are, again, I have to repeat this, is greater for women in the household. We see significant negative income shocks for patients and their caregivers. This is just a small example, and we are not using this information, and we're not producing enough information to bring this to the table. On top of everything, and I'll stop after this comment, is after measuring, the other thing is that when I work in taxation, for instance, most of my counterparts are men. And in the economic commissions at Congress, most of them are men. And again, women ourselves are immersed in the social norm from a patriarchal system that is working against us. And when we bring discussions about tobacco taxation, everything is about all the costs of illicit trade. What about this? Is this not important? Does this not justify the effort to making the institutional changes to control for illicit trade, but address the urgent needs of households and of women in these households? So these are the things that keep me awake at night. And I think there's a lot of work to do in the future.
Thank you both, Kelsey and Blanca, for those words. And I just wanted to, talk about one thing that you both mentioned, that tobacco, I mean, sometimes we look at it at, a standalone issue, but there are so many other issues that it brings up in society. The gaps between just even men and women in terms of education, income, caregiving responsibilities. So sometimes we think, okay, well, we're going to develop these policies, programs, and interventions in this one area, but we have to kind of look broadly and more specifically about what about, the gaps in education? What about where women are living? What about, other conditions that these populations are enduring? And so I think it's really important for us to take that piece away as well and think about, even when we look at just the policies that exist, such as tobacco control policies, it's broader than that. So one way is definitely through human rights, but we must be looking at other policies that we have to also change in relation to that so that we can provide sort of, better outcomes for both men and women. So thank you for answering that question. We have one for all of the panelists now. So if you could prioritize one concrete action in the next 2 to 3 years to really advance gender responsive tobacco control, what would it be? And I invite all of you to respond, and you can come off mute in any order.
I could go first. So initially, I was in denial when I saw the statistics about the shift in seeing that more young girls and young women are using e-cigarettes. And I wondered when this shift happened because cigarette smoking was a taboo in my country. Like, when did this happen? How did this happen? And then I realized, oh, it was the marketing strategy that had changed. It was now the introduction of the e-cigarettes and the shisha, the colorful vapes. So if I could prioritize one action, it would be to explicitly integrate gender into tobacco control policy and regulation, and particularly in how we address these emerging products and the digital environments, because well, the next generation is like a TikTok generation, and this is where we see a lot of content that is glamorizing e-cigarettes. And this is something that we've also been calling for through the Global Youth Voices Declaration, where the youth globally are demanding for stronger youth-centered policies and accountability, because right now the frameworks are still broadly designed, but what we need are policies that recognize the differentiated exposure and then address how these products are positioned. And then we also need to close the gap in the areas of digital marketing, because like I said, the next generation is like a digital generation. It's TikTok and Instagram. So if we don't act at that level, we'll continue to respond after the uptake has already happened, and that's really challenging. So the priority is shifting from like general protection to a targeted prevention, really. Thank you.
I have a comment to complement what Yvette was just saying, if I may. I think we need to continue our integrated approach to from the Framework Convention, addressing all the multi-dimensional elements of the epidemic. But if I needed to choose one aspect from the Latin American perspective, I think we need to rethink the current design and the observance of TAPs, advertising and promotion controls, because they are not working in favor of women. Certainly, we have and the industry is exploding that to its own benefit, definitely. From the advocacy perspective, I think we need to make ourselves a relevant stakeholder in the women's rights and gender discussions in our own countries and at the global level. We need to step up our efforts there. In the case of Colombia, we already have a discussion and an initial framework to address, for instance, all these issues of caregivers, but the tobacco issue is completely absent, and we have a lot to offer in terms of policy tools. to address it with a preventive approach these costs, not just from the mitigation approach of, oh, we have the cost and then we need to pay with social protection measures and with not preventive, but remediary approaches, which are easily overwhelmed with the current fiscal circumstances and limitations from all governments all over the world. So those two things I would suggest.
If I can, I also want to add something to add on what Bianca and Yvette already said, but also I think we need to address cessation, because at the moment cessation is tackled as a universal thing. I mean, with the men and women, they differ. And this is something that needs to be addressed. The addictiveness, the way women are addicted, we have our hormonal cycles where it is easier to relapse. There's so many changes going on in our bodies, and this is not tackled enough. The cessation services don't cater for women per se. And also the products that women use, especially in different areas like in the Middle East, they are different than the regular cigarettes. And the addictiveness of products like the water pipe is higher because there's not only the nicotine addiction, there's the social norm that goes with it and the fun and every social aspect, which makes it much easier to quit. So I think there are also the cessation interventions, we need to work on them to cater for women and to cater for the new products that we as women use. So this is also something that needs to be addressed, I believe.
So I'm glad I get to go last because my answer feels almost too easy. But if I could pick one concrete action in the next 2 or 3 years, it would be tobacco endgame policies. Because if there's no more tobacco, there are none of these issues. I know that sounds maybe naive or futuristic, but I'm sure many of you saw the news out of the UK this week. They passed a tobacco endgame policy, and more places are seriously taking action in this area. So hoping to see more and more of that in the next 2 to 3 years.
Thank you so much to our panelists. I see that we have quite a few questions in our Q&A, so thank you to the attendees for including them in here. We'll try our best to get through a few of them. So one of our first questions that we have here is around the current disaggregation of data by gender at the country level in UN member states. To determine whether tobacco control objectives are achieved for women and girls, whether for exposure to tobacco smoke, initiation to smoking, and new nicotine products. Do you think countries have more work to do in this area? And maybe the panelists, if they want to speak from their own country perspective of the data that they've seen, whether they're satisfied with that or if there's more work that needs to be done. I know a lot of you actually shared some data today, which is really great, but maybe we can hear a little bit more about that.
If I will go first there from the Colombian perspective, I think again data are relatively robust in terms of measuring prevalence. Maybe we need to think more about better analysis, not the generation of data, but analysis with this data, including more multidimensional aspects, bringing intersectional analysis from ethnicity, socioeconomic status, regional perspectives, because we have a lot of different situations of the tobacco epidemic across regions in Colombia. Colombia is a very diverse country at the regional level. So from that, I would say, yes, we need to improve. Obviously, we always want more updated surveys and things like that. But I would say that even with what we have that is limited, we can use it more in terms of intersectional analysis and approaches.
That's a great answer. I don't know if anyone else wants to add in.
I think also the data needs to be renewed all the time. That's a problem. So we have some kind of survey and then it stays there for ages. And we also have to consider that sometimes there's women are not really willing to give the data. So you would ask, do you smoke? And you would get a no for an answer because they are worried that somebody in the family is listening in. So I think we also need to be very aware of how we collect the data and do that in privacy and safe spaces to get a true reflection of what is actually going on.
Great.
I could add on to what.
Yes, go ahead.
Okay, I could add on to what Blanca said. The data issue is actually very, very important because how then can we strategically use the data if we do not have data at all? So I think it is very important that at country level, we invest in resources to actually collect our own data and then develop our policies, our national policies based on the real-time data that we have because the trends keep changing. 5 years ago, what we're currently experiencing now wasn't the same way. Now we have more girls getting into shisha use and vapes and all of these e-cigarettes. So real-time data is very important for us to make policies that will tackle the real issues that are happening on the ground as of today. Thank you.
Thank you. And I encourage the panelists to also answer any of the questions in the chat that they see that are specific to theirs. I know I see one about what data do we have on gender differences related to price and tax increase? And has Jordan attempted to use higher taxes on water pipes and hookahs? And I know, Larissa, you were just typing, so maybe if you want to quickly respond to that.
Yes, so as to the price increase, we had recently 100% increase in water pipe molasses taxation. So the price went a bit up, but the price it's still cheap. That's the problem. It was just the taxation was really low. That's why it wasn't. That's why it was increased. I was just looking what was the first part of the question, because okay, data, the price increase. Actually, funny enough, in Jordan, and I can't speak about anything, that women are less sensitive to price increases than men. Men are more sensitive. So when a tobacco product goes up in price, it affects men more than women. And maybe it's related to the part that the man is in general responsible for the household economy in the broader sense. So men are more price sensitive than women in Jordan to tobacco products.
Thank you, Larissa, for sharing that. So I know we have 7 minutes left. So I do want to ask this question from Beatrice. INWAT is defining its future for the next few years. What would you suggest should be 3 key priorities to ensure we prevent tobacco and nicotine use among girls and women? And I know we don't have enough time to maybe do 3, so even just one thought on that. And she has another question here, and cessation for women who smoke and use nicotine products. So you can answer either part of that.
I can go first. I think I'm involved with INWAT, so maybe I have a head start here. But I think being present in the global conversation, there aren't a lot of people speaking to this issue at the COP, at the WHO, at the UN human rights treaty bodies. I think showing up is a huge, huge start for us. So if I have to pick one, I think that's it.
If I have to pick one, it would be taxation because it works the fastest. Of course, I am biased. I have to acknowledge that. But and in the current scenario of fiscal difficulties at the macroeconomic level for many countries, it should make sense. Obviously, they're not going to openly discuss this. I think the climate, the discussion climate is not the right one to talk openly about increasing taxation in general. But I think that privately governments are willing to consider tax increases, and we need to keep persevering with those conversations. I think it's our best chance. Obviously, it would give us opportunity to measure differential impacts of taxation that we need to make that extra effort. But yeah, taxation, don't forget about that.
Yeah, but I think also what we need to address is about the difference in the health impact of smoking on men and women. People are not aware. They think it's the same, but the tobacco use impacts women more than men. So when the study came out, you lose 20 minutes for every cigarette you smoke of your life. So people were shocked when it was 17 for men and 22 for women. And I think we need to highlight this more to raise awareness on the effect this has on the women's health. And in the end, it will affect the whole family, because the women are the cornerstone of the family. They are the caregivers. They are the caretaker of the whole family. So when women get sick, it's the whole family that gets sick. And in the end, it's the community that gets sick. So we need to shed more light on the differences on health impacts of tobacco use.
If I would pick one, I would pick collaboration, and that's with organizations that are talking a lot about women's rights. This is because the tobacco control voice would now be amplified because it's a collaborated effort. So if we collaborate, we will get the message to platforms that we currently cannot reach. So the collaborated effort will really take our message and the voice to rooms that the message needs to reach. Thank you.
Thank you so much to all our panelists for the wonderful reflection and the discussion that we had today. There was so much that was brought up in this webinar, and I hope that it was, very much needed for those that joined this session as well. We are going to be providing links to all the work that's come out of the organizations that help put together this webinar, and of course, from the organizations that these wonderful women are a part of. I do just want to end on saying that we're extremely lucky to have these women that are on this panel be part of the tobacco control efforts, especially those that I've witnessed in the chat list, the attendees. Such phenomenal work is happening. I want everyone to feel encouraged that we are taking the right steps towards integrating gender where it needs to be integrated, but also to do the work in terms of collaboration and networking. I think the International Network for Women Against Tobacco is the perfect organization to showcase what happens when women come together, and just to have even the different contexts and understandings from different places is so important for us to feel rejuvenated and passionate about doing the work in this area. And so I really want to thank you all again for attending this webinar today. It was great having you all. Thank you so much.
Thank you very much. It was a great opportunity to be able to meet all these and talk with all these amazing women. And I think when women take the lead, change is about to happen.